Yeah, the MHRA, which is basically the UK's version of the FDA, is warning people with severe allergic conditions to avoid being vaccinated right now. Local health officials say these early reactions are not cause for concern. Hospitals around the country are awaiting FDA approval of the Pfizer BioNTech vaccine. After seeing 2 severe allergic reactions in the UK, Britain's medical regulator warns that people with severe allergic reactions should avoid the vaccine. Dr. Dobbs is speaking out about these early vaccination reports.
But certainly we know anyone can have an allergic reaction. So we'll see how that plays out with their recommendation for people who have severe allergic conditions to not receive it in England. But so far, we'll wait and see what the data shows and what CDC says about it.
Dr. Dobbs also says common side effects being reported are soreness at the injection site and possible fatigue, but he says it's nothing to be alarmed about. Health officials say Mississippi could receive 25,000 doses of the vaccine by next week. Hospitals will receive the vaccine first for frontline healthcare workers.
Most people are very excited that the vaccine is here. I think that we will have a lot of our team members that want to take the vaccine.
Baptist Memorial Healthcare says its employees with direct patient contact will have the option to receive the vaccine first. They're also watching the reports out of the UK and will follow FDA and CDC recommendations when it comes to possible reactions to the vaccine.
And so we will take their specific recommendations as we have continued to do about the vaccines as well. We're looking specifically for any categories of patients that should be excluded or considered for exclusion. And so we'll be watching for that information.
Baptist Memorial says it will start vaccinating its employees a few days after their first shipments of the vaccine arrive. This could be as early as next week. And when determining how many doses each hospital will get, that really is determined by the individual states. There will likely be several factors, including the size of each hospital and how many COVID-19 cases each hospital has. Reporting in Jackson, Cecil Hannibal, 16 WAPT News.